Good morning, I'm Robin Snyder. Welcome to the Indiana Summit on Smoking Cessation. Please join us at registration.
I'm here today to try to help participate in terms of finding out how the pharmaceutical industry can help partner with the state of Indiana to help curb the smoking rate.
What I find interesting is the many different views represented here and the united effort to show concern for the health of various communities present.
We have to come up with some new strategies, and so, getting the right people in the room is a major step in that direction.
We targeted pretty much every group that could have a potential contribution to the process. We have state organizations, we have faith-based leaders, we have representatives from unions, we have representatives from employers, pretty much any group you can think of. If we engage the public, engage providers, engage systems, engage employers, I mean, the data's clear. We'll make a difference as a group.
It's a very focused day, very targeted questions and sets of activities that require everyone to come together on this, be on the same page, to look at the issues from a variety of perspectives, and then come up with some consensus on where we want to go.
I think we're going to end up at the end of this summit, at the end of today, with some new strategies and some new ways of going about our work that we haven't done before. Part of that is because we have some new organizations at the table providing us with new ways and new creativity on interventions and old ideas that we know will work.
It was just reported that we're now number 2 in the country in terms of smoking rates, and we have made some progress here, particularly on the youth side, but we're just not getting adults to quit smoking.
Our goal is to get people working together as a partnership, moving Indiana forward to reduce the prevalence of smoking overall through strategies that during the process of this summit here today that we will define and we will implement over the next 2 years as we move forward as a state together.
We really are creating a strategy going forward. We've had to agree upon what the target is, and today we've decided 18% smoking rate by 2015, set that target, and now we're going to create strategy to get there, and I think we're going to come up with some really unique and fresh strategies for Indiana.
Everybody's perspective is so different based on what they do and where they work, and so everybody's got a little piece of the puzzle, and I think if we can kind of collectively put all the pieces together, I think they're going to have a really effective output from today's session.
I applaud the efforts bringing in a facilitator to help people who have done this in other states, like the lady from Virginia. We can learn from other states, we can learn from each other.
It's very evident that we have a lot of enthusiasm and a lot of support in this room. There are over 70 organizations that are represented here. Everyone recognizes that Indiana's lagging behind, but they're not satisfied to just sit back. They want to do something, and they want to look for some new models and some new ways of going about solving Indiana's high smoking rate.
There are some strategies that I'm already hearing starting to be developed that will be fresh, like bringing new voices to policy. Our policymakers many times hear the same voices. It's time to bring a fresh approach, bring more voices to that. And I do think nationally we're at a place where people are concerned about the cost of health care. They're concerned about what we deliver.
This whole summit has been designed around a particular approach for groups to move from talk to action and get results. And so they are 3/4 of the way through a very ambitious agenda where they've already agreed on what their baseline is. They've set a very ambitious target that they'll check at the end of the day. They understand what works based on evidence and experience, and they're now taking their knowledge and translating it into actual strategies that they themselves will implement. So that's pretty good.
For me, this was a great opportunity to partner with all areas of people across the state of Indiana. I think we had a great sharing of ideas, some possible solutions that we can do, and then actually taking ownership onto those things by when we divided up into our groups and named problems and took ownership onto an action plans.
I don't know that we've had this kind of an event before, and it's given a lot of I think creative power and organization to what our plans are going to be as we approach the next legislative session. We've got a number of priorities that we'll be working on. Some of them seem almost overwhelming at times, but an effort like this at the highest level in state government shows that we've got a chance to be successful, and I think we will.
I think one of the things from my perspective and those of my colleagues at Partnership for Prevention is the excitement around Indiana's summit activities. We hope will motivate other states to take similar actions. So we plan to use the outcomes of today's discussions as a model to share with other states so that they might take on similar summit activities.